Okay, now we'll look at another scenario in radiography, and this is where you're talking about adaptation of exposure techniques to patients, okay, in radiography. So around these areas, around this particular area, what are the things that we look forward to? Okay, what are the things we look to achieve? So exposure does have to do with, all those radiation energy, right? Exposure to radiation energy. So adaptation of exposure technique in radiography just simply means what? You are trying to adjust a lot of factors. Do you understand? So that at least the radiation energy that is getting to the patient is not too harsh. Okay? So you are trying to suit the patient habitus, body habitus. You are trying to adjust the radiation based on their age. Of course, the radiation given to adults, to older people, and pediatric patients shouldn't be the same, and based on their conditions. Do you understand? So you're just ensuring that, okay, this imaging I'm doing, I'm able to get the image I need, and the patient doesn't have too much side effects. Okay, so it's patient-centered. So what are the things you take in if you are trying to adopt, exposure techniques? Thin and small patients, you just do all those lower, kVps, to avoid overexposure. You might also use a grid, that's why you're having all those boomerang grid, a lot of them. The grid will basically block some of the radiation energies from getting to the patient. So for large and obese patients, is of course the kVp is now increased. The mAs is also increased because you are dealing with thicker tissues. Okay, so you can also use grids to reduce the scattering, and longer exposure times may be needed. All right, so have a special lecture which will be coming up, which will be talking about how you can be able to handle obese patients, to be specific. So a specific adjustment is pediatric patients. Also, the kVp will be low, mAs will be low. This is due to smaller body size and higher sensitivity to radiation. Then tight collimation and shielding are very, very also what's important here. Then for old patients, their bones may be fragile, so you also reduce the exposure, and all of that. So you also you adjust the exposure, that's all those rays and everything, and also this is also depending on what the part of the body you are dealing with. If I want to image in the stomach, is different. If I want to image the brain, it's different. If I want to image the pelvis, is different. If I want to image the leg, is different. Do you understand? So that's what we got. So patient mobility and cooperation. You have to also look at the patient. Are you dealing with a child? Are you dealing with a psychiatric patient? You understand? So you also arrange the imaging as related to the patient. Then also critical patients that are in intensive care units or that have undergone some crazy traumas or so. So special considerations include pregnant patients, where you have to use shield, and for the time that you are imaging, just make sure you get it accurate, because you don't want to put the person under the same imaging conditions more and more, because it could result into issues. Then contrast studies. Okay, so this is what we got for adaptation of exposure for patients. Okay, this is actually for patients in radiography.